Montgomery Hospice tries to figure out what you want.
Patients are not just an illness. What really defines them is how their whole life has affected them. Their spiritual life, their physical life, their social life.
There's so many things that we can do, even after you've heard there's nothing else to be done.
Hospice services are more than likely going to be appropriate for every single person at some point in their lifetime and every single family. But thinking about hospices is a pretty emotional thing for everyone. One of the things that I try to keep in mind in a family meeting is that I'm looking for the patient and the family's goals. I want to know what their goal is from here on out in their illness. Once I know those goals, I can often say, this is the care that you're talking about. You're not naming it, but this is what you're talking about. Very few people understand that we can care for them in their homes, wherever that home is, whether that's their family home, whether that's an assisted living facility, whether that's a nursing home. We'll care for that patient in place.
Most of our patients actually don't have cancer. They have other illnesses as they get older, including dementia, chronic obstructive pulmonary disease, heart failure or heart disease of some sort, strokes. There are some unusual neurologic diseases that often come up, such as amyotrophic lateral sclerosis, which is Lou Gehrig's disease. So there are so many different things. I usually ask physicians and the families this question, which is called the surprise question. Would you be surprised if you got a call 6 months from now that the person died? Would that shock you? And if the answer is no, then you're probably eligible for hospice care. And that's really a simple screening test.
We have to help people realize that this is a specialty, that many of the people, most of the people who will be caring for them are certified in this field. Our medical director is certified in hospice and palliative care. Our nurses are certified in hospice and palliative care. That's our specialty. If you have a heart problem, you go to a cardiologist. If you have a small child, you go to a pediatrician. If you have a very advanced illness, you need good end-of-life care. You need special care from people who have been trained in that field.
So you have the beauty of you still have your doctor that you're so familiar with, and he's familiar with your background and what you've been through, that you also get this medical director, this other doctor that can collaborate. Our palliative care docs collaborate with your physician. End-of-life care is a little different from just regular, every day when you go to the doctor. But as we become so complicated, as our diseases progress, our care is even more complicated. Our needs are so complicated that having that expertise from another physician in collaboration with your physician can be very helpful.
Symptom management really is what makes us different. Symptom management, or having symptoms, actually affects your quality of life and probably your functional status. Functional status is really your biggest predictor of how long you have left to live and how much quality of life you're going to have during that life. When I say functional status, I'm talking about things such as being able to get up in the morning, get out of bed, get dressed, feed yourself, go to the bathroom, brush your teeth, and put on clothes. Those are just some basic activities of daily living. And depending on how much pain, nausea, vomiting, shortness of breath, anxiety, nervousness, those will impact what you do from day to day. And so if we can alleviate some of those, then your quality of of life improves, and therefore usually you're just overall feel better, even though you do have a serious illness.
People believe that if they sign on to hospice, they're going to have to stop all their medications, all their treatments, and there's just nothing else to be done. But again, we don't stop medications. We are very much involved in symptom management. We want our patients to be comfortable. We want them to do as well as possible as long as they can. So if the medications need to continue, we do that for them. We like to tweak the medicine sometimes because we know that sometimes the side effects are worse than anything else and may be causing some of the symptoms the patient has. So we do, that's our specialty, is symptom management.
Pain management in hospice is very important because that's one of the things that people complain about the most, and it's very debilitating. Therefore, we pay a lot of attention to pain.
Our nurses are very well trained in how to assess for pain. Oftentimes, signs of pain are missing, or they're very subtle, especially as things go on. Maybe someone's not as alert, they can't tell you they have pain anymore. But we look for the furrow in the brow, we look for maybe a little grimace.
And so we spend a lot of time in training, learning about pain and really how to manage it and manage it effectively with all kinds of medications, sometimes tactile treatments like massage therapy, with even prayer, Reiki. These are all modalities we can use to treat pain in this day and age.
We're looking at individuals with needs. For most, that involves addressing physical problems and physical symptoms, but for so many others, that involves emotional and spiritual kinds of needs and questions. Sometimes people will express a need to take care of some unfinished business. It may be something they've always wanted to do or something they want to do for one last time. Oftentimes, chaplains will help individuals with those statements that they need to say to family members and loved ones. I love you, I support you, will you forgive me, I forgive you. All of those things that need to be said.
Our unit of care in hospice is not just the patient, but it's also anybody who's important to that patient. So that could be family members, it could be friends, it could be neighbors, it could be the caregivers that in the facility that they're living in. But those are our unit of care, and that's who we provide support to.
So many family members feel guilty if they walk out the door when someone is ill, for shopping, for a hair appointment, even to go to the doctor themselves, which is so important because self-care for family members is so critical. And so fortunately, our volunteers can provide a respite care for a few hours so that family members can take the time that they need to care for themselves, as well as to provide needs for their loved ones.
There's so many reasons to have anxiety at the end of life, either for the person who's at the end of their life or their family members who love them. So as social workers, we come in and we can sit with a family and find out what the sources of the anxiety are and how they're coping with it. And what's great about that is then once you know what the causes of the anxiety are, you can address it. And it's amazing how you see people just become much more peaceful once they can address their anxiety and what's going on in their fears.
Montgomery Hospice does not turn anyone away from care, whether they have insurance or not. Generally, most of our patients are covered by Medicare, which covers 100% of the benefit, and the patients and the families do not have to worry themselves that they will go broke. We're paid a set fee, and we'll provide you with the services such as a primary nurse for you, a a spiritual counselor of some sort, a social worker to help you work through some issues, possibly an aide, and possibly provide volunteers for you to help do some other activities. And that's at no cost to you. In addition, after the person dies, the family will be cared for in that 13 months afterwards. They'll have contact with someone in our bereavement department.
This is what many people are looking for, but they don't know it. They don't know that care exists.
It's never too early to learn about hospice and find out about what we can do. We're happy to come out and make a visit just to tell you what we can do so that you can make an informed decision later on.
Montgomery Hospice believes that this is a journey that we walk with you on. We're not there to push you down a particular road, to make certain decisions. What we try to do is give you the best advice at this difficult time.
The most important thing I do is that I honor your wishes, that I honor your goals, and I help you reach those.
Some people think that enrolling in hospice means giving up on life. Actually, it's quite the opposite. Enrolling in hospice means affirming every ounce of life and living that can be supported at a very difficult time.